Most of us know the flu as a temporary annoyance, a whirlwind of fever, cough, and muscle aches that leaves us reaching for tissues and cough drops. We grit our teeth, ride out the storm, and anticipate a full recovery. But what if this familiar foe had a darker side? A potential to inflict damage far beyond our respiratory system? Emerging research suggests that in some cases, the influenza virus can penetrate the protective barriers of our brain, leading to a range of neurological complications. While these instances are rare, they underscore the potential severity of this common illness. This isn't about a little brain fog after a nasty bout of flu. We're talking about potentially serious neurological issues. This essay will delve into the science behind this unsettling phenomenon, exploring how a simple flu virus can sometimes wreak havoc on the human brain. The brain, often dubbed the body's command center, is usually shielded from invaders by a tightly regulated network of cells known as the blood-brain barrier. This barrier acts as a vigilant gatekeeper, allowing essential nutrients to pass while blocking harmful substances. However, the influenza virus, a master of disguise and a cunning manipulator, can sometimes breach this fortress. Once inside, it can trigger a cascade of inflammatory responses, disrupting the delicate balance within the brain. Scientific studies have begun to unravel the mysterious link between the flu and neurological complications. Researchers have found evidence of the virus in the cerebrospinal fluid, the protective liquid that surrounds the brain and spinal cord of patients with severe influenza. Studies using animal models have provided further insights. Researchers have observed that influenza infection can lead to inflammation and damage in various parts of the brain, including regions responsible for memory, learning, and motor control. The connection between the flu and neurological problems isn't just confined to scientific journals. It's a reality for some individuals who have experienced the debilitating aftermath of severe influenza. Take, for instance, the case of a young athlete who, after a seemingly ordinary bout of the flu, developed encephalitis, a potentially life-threatening inflammation of the brain. Despite receiving prompt medical attention, the young man faced a long and arduous road to recovery, grappling with lingering cognitive and physical impairments. Section 5. The flu's journey to the brain. How exactly does the flu virus, a seemingly respiratory foe, gain access to the fortress of our brain? Scientists believe there are two main routes of entry. The first involves a direct attack, where the virus breaches the blood-brain barrier, sneaking past its defenses to directly infect brain cells. The second route is more indirect but equally insidious. The body, in its attempt to fight off the virus, launches a massive inflammatory response. While this response is meant to be protective, it can sometimes go into overdrive, causing collateral damage to the brain. Section 6. Shielding your brain, prevention and treatment. The good news is that we are not powerless against this microscopic foe. The most effective weapon in our arsenal is prevention. Getting an annual flu shot remains the single most important step in reducing the risk of contracting influenza and its potential complications. Other preventive measures include frequent hand washing, practicing good cough etiquette, and avoiding close contact with sick individuals. Section 7. The importance of early detection and treatment. If you do come down with the flu, early detection and treatment can make a world of difference. Antiviral medications, if taken within 48 hours of symptom onset, can shorten the duration of the illness and potentially reduce the risk of complications. It's essential to be aware of the warning signs of neurological complications, such as severe headache, confusion, seizures, or difficulty speaking. If you experience any of these symptoms, seek immediate medical attention. Section 8. Ongoing research and future directions. The scientific community continues to delve into the complexities of the flu's impact on the brain. Ongoing research is exploring innovative therapies that target the virus's ability to infect the brain and dampen the harmful inflammatory responses it triggers. Future research also aims to identify individuals who may be at increased risk of developing neurological complications from influenza, allowing for personalized prevention and treatment strategies. Section 9. A final word of caution. While the flu's potential to affect the brain is a cause for concern, it's crucial to maintain a balanced perspective. The vast majority of influenza infections resolve without any lasting consequences. By staying informed, taking preventive measures, and seeking prompt medical attention when necessary, we can minimize the risks and protect ourselves and our loved ones from the flu's potential reach into the brain.